Mini dental implants. What are they? How are they done? Who are they for? And are they for you? We find out next on Trending Health. Hello and welcome to Trending Health. I'm Kevin Sylvester, and today we're going to learn about mini dental implants. And here to tell us all about it is Dr. Lilian Jaime from Sunshine Dental in Albuquerque. Dr. Jaime, thanks for being here.
Thank you. Thank you for having me, Kevin.
Well, I'm looking forward to learning about mini dental implants, and I know our audience, this might be the first time they've heard those words. So can you tell us what a mini dental implant actually is?
Yes, Kevin. I just brought this jaw just to give you an example.
That's a human jaw, right?
It is.
Not a real one, it's a model.
Okay. But regular implants, they usually make a very big hole in there to be placed. A mini implant is a tiny little hole that is made. The mini implants are a small little post that goes into the jaw and has a little ball on the top that attaches the crowns or the dentures or whatever prosthetic we're making. It's more affordable, it's a lot faster, it's less discomfort, and it can be fixed very quickly.
Yeah, I think a lot of people heard less, and less. That's good. Sometimes people think bigger is better, but a bigger hole in the bone, not always better for patients.
Absolutely, it's not. It takes a lot more time to heal, and it takes a lot more time to be fixed.
All right, Who is this for? What patient out there, the person watching, who should consider a mini dental implant?
Well, there are different kind of patients that can kind of come with that kind of need. For instance, we have the patients that usually complain the most are the people that are wearing lower dentures. Most of the lower dentures are very hard to keep it in their mouth. So what we do is we put like 4 mini implants in there, and the denture has like a little attachments that go over the implants, and then we seat it. And it's snap into that lower jaw, and it maintain it, and it's stabilized and hold it and secure the denture, so the patient don't have to be embarrassed.
Sure, don't have to worry that the glue, the goop, right? Now, this model, it snaps in, but when you put the mini implants in for the lower denture, is that in, or is the patient able to take them out?
Well, for the dentures, they can remove.
Gotcha.
It's removable. You can take it out, you can put it in, but the little balls into the implants will snap the denture and secure the denture in place.
Sure, so they maintain that like their normal denture that they wear, but this is just better, more stable.
Absolutely.
They can eat what they want.
Absolutely.
Yes, which who doesn't want to eat what they want? That steak can be yours with the mini dental implants. All right, so that's lower denture. What about folks who have upper denture? Can you do upper dentures too?
Absolutely. And one with that thing about the upper denture is that when we make the dentures, we don't put any part of the palate. There is no more plastic in there, so the patient can taste the food better. And then also we'll place some implants in there, and the denture has also the attachments in the inside part, and it snap and keep it secure. Also help the patients to speak and talk better because the plastic is not in the way.
Yeah, we've all heard people who are talking through their teeth, right? And it's tough to understand them, with the denture or, if it's sliding around too. We've all unfortunately seen that. It's embarrassing for folks who have the dentures and don't want to say anything.
Yes.
This eliminates that problem.
Absolutely. And the other part also, for people that gag.
Sure.
There's no more gagging because the plastic is not in the back of the palate. So it's really very convenient, and the patients really enjoy it.
All right, I'm sure your phone number at Sunshine Dental is burning up right now for everybody out there with dentures that wants this solution. It's a great reason to call to set up a consultation to see if this is right for you. But it's not just for denture wearers, is it? This is not just for denture wearers.
No, not at all. Actually, you also can have situations where patients can have a trauma, they can have an accident, and they just lost a tooth. Well, we can just make just one implant, just for one tooth, and we make a zirconia crown that looks just like your natural tooth. and it mimic exactly the same color of the rest of your teeth. And it's fixed, it doesn't take it out, it's cemented permanent. And the patients can enjoy the smile.
Yeah,
right away.
I think that's an important point, Doctor. If it's just one tooth, or if it's a couple teeth, right? You can do a couple teeth in a row.
Absolutely, yes. This would be the other option too.
There you go. So when you do that, it's going to look as if that's someone's normal teeth, like that it's been there. It's going to match color-wise. It's going to feel the way it should feel.
Yes, it will be like having your natural teeth again. It will be permanent, cemented over your teeth, and it will look just like the rest of your teeth, and it won't come out. And you can be able to enjoy it again, the food that you have been able to chew.
I imagine many of your patients, they've come in and said, well, I've waited because this is expensive. This is not as expensive as you mentioned, the traditional implants and maybe some other options. This is more affordable, isn't it?
Oh, absolutely, yes. Because the conventional implant, you had to be multiple times, there are like two different surgeries that are involved. With a mini implant, it's just one visit, one time, and it can be fixed in a few days. Patient can have their teeth back.
Wow, think about that. It's done in one visit, and it's probably it's not probably, it is more affordable than you think. That's why you need to make that phone call to get that appointment, that consultation with Dr. Jaime at Sunshine Dental. All right, when we come back, we're going to talk more about what they can expect when they come in for the consultation and when they have the procedure done and what happens afterwards. We're going to do that next, so I look forward to hearing more about that. Stay with us.
My name is Tim Greer. I'm an old man. My teeth situation has always been kind of marginal. I've gone to a lot of dentists who had a lot of work done, and I was going through the struggles of eating and stuff, and I decided it was time to upgrade. So I came here, made an appointment, came and talked to the doc, and she was willing to sit down and give me all the time I needed, and then went through all the steps of what's going to happen and all the possibilities. So I know a lot of people think it's out of their budget and everything like that, but if you can't afford to pay cash, they work with you. And you can make payments just like on anything else. It was gentle and everything that you're looking for when you're getting major work done in your mouth. I had a pretty good idea of what they were going to look like because they make sure you know what your next step is. And then they put them in, and I was amazed. This is New Mexico, so we eat a lot of tortilla chips. And I went through years where I couldn't eat tortilla chips because my bottoms were so bad. And now I'm back to tortilla chips, and I know that sounds silly, but for me, it's a major accomplishment with these new teeth. I just love it. I had forgotten how to smile for many years, and then once I started looking at the dentures before they put them in, and I smiled, they took pictures, and it was just amazing. Then I went home and stood in the mirror and smiled some more. They look so much better than what my natural teeth did, so I'm really happy with the whole thing.
Glad to have you with us here on Trending Health. Kevin Sylvester, Dr. Lilian Jaime from Sunshine Dental. We're learning about mini dental implants. We talked about what they are. We talked about why you should make that phone call, especially if you're missing a tooth. You have dentures that just aren't working out for you. Can't eat what you normally want to eat. There's probably somebody watching that hasn't had a T-bone steak in a while that wants one. Well, we're gonna make that happen for you here. Dr. Jaime, let's talk about the consultation process. Someone makes that call to Sunshine Dental. What can they expect when they walk through the door?
Well, they get a free consultation. We do a convened X-ray, and we take an intro pictures. We invite the patient in a consultation room, and we present all the pictures, and we sit down together, and we make a plan that will customize specific just for them. And it's exciting because we can restore and give them that smile that has been looking for, and they've been hiding with a mask for so much time, and it's so exciting for me to present them all the different options that will restore that smile again.
You mentioned something there about masks. I'm sure there were some folks, when we were in the pandemic and masking was mandatory, they're probably happy about it. So people don't have to see that I'm missing teeth or that my dentures are loose, and now that the masks are off again, there's probably some anxiety some patients probably have. Have you recognized that with folks who come in?
Oh, absolutely. I just had a patient like that he came and visited me. It was using a mask and say, Dr. Jaime, thanks God for the pandemic, I've been able to hide my smile. And I was able to restore his smile, and he's like, I don't know how to smile. I had to learn again how to smile because he had been hiding behind this mask for a while.
Wow, I kind of got chills with you just saying that, thinking of this poor gentleman.
Yes.
Felt like he couldn't smile, was embarrassed to do so, and you helped restore that smile for
Yes.
him. That's got to make you feel good.
Oh, it is so good for me, because I'm very passionate about providing the patients the best treatment that they need.
Yeah, by the way, if you can't tell, Dr. Jaime's great to talk to. You're going to feel like you're in great care if you go see her for a regular checkup or you go see her for a mini dental implant to find out if that is right for you. And it's also important that they do come for the consultation because I'm sure there's some folks watching saying, that's not for me. I've got gum disease or I've had this problem. It won't work. I've tried this before. That's why they need to come. You'll give them the answer.
Absolutely. I have that solution for them. Whatever is their need, we're there for them. And we understand dentistry, most people are just afraid of coming. But there is no reason to be afraid because the fear is taking away the possibility that they have to have a beautiful smile again. They can be able to socialize again. They can be able to chew their food wherever they want to eat. And they can be dating again.
Sure, life-changing and many different options there, as you mentioned with that. All right, let's talk about the procedure then. So the patient comes, the consultation, you decide together, hey, this is right. We're going to go with this option, whether it be replace a tooth, couple teeth, instead of dentures. What is the day of the procedure like for the patient?
Well, when they come in, we make this specific customized treatment for them. We have a treatment coordinator that comes and explains to them the cost. We partner with different finances company to help them to afford the dental work. The treatment is so fast, the placing of the implants, that most of my patients ask me, oh, you're already done? Because it's so painful and so quick.
Yeah, so painless, quick, it's done, and the patients are like, wow, that's over. So the procedure's rather quick, which I think anybody who goes to a dentist, they like quick procedures when it's done there. But when it's done, when things are completed, what is the aftercare? Do they need to ride home? What should they bring somebody with them to drive them home? What should they do?
Actually, since the procedure there is no discomfort at all in that process. I give them ibuprofen, but most of those patients, when I call them the following day, they say, Dr. Jaime, I did so well that I didn't have to take any ibuprofen because it was very comfortable.
Wow, that's by the way, she calls you the next day. That's fantastic care right there on the follow-up. So patients right away, you mentioned most of them don't feel much discomfort at all. Do they have to just have a liquid diet for the day? Like when can they start eating? What can they expect right away?
Well, absolutely. The first day of that, after the treatment, we tell the patients don't eat through the side, at least for maybe a few days, In a couple of weeks, we get that restoration back, and we cement it over those mini implants, and they're ready to eat whatever they want to eat.
And what about daily maintenance? Do they brush their teeth as normal, use a rinse as normal?
I recommend for them to come for the cleanings every 6 months, but also to use a water pick or a water floss, so that way they maintain those implants in a very good shape.
Certainly, yeah, it makes sense if you're going through the procedure. Again, minimally invasive procedure, as Dr. Jaime said, it's 1 day. Most patients say, have you started yet?
Yes.
You're finished, right?
Yep, absolutely.
And then the maintenance sounds like it's normal maintenance, what we should all be doing every day.
Yes. I think the water pick should be for everybody, You're brushing, you're flossing, and you water pick your teeth.
Yeah, I was going to ask about flossing. Can you floss around a mini dental implant?
That's what the water pick is.
Okay.
It's like a water floss.
All right,
Yeah.
you can tell maybe I'm not using the water pick. I'm going to get one after the show. with Dr. Jaime to make that happen there. You can scold me later for not doing so. But with that, so normal maintenance for this, and
Yeah.
it's you'll check it on the normal like 6-month checkup.
Yes, that's what we do. You know, we bring them back, and then they tell me, Dr. Jaime, these teeth have been working amazing. Thank you very much for working with me through the whole process and helping me to give me the smile that I always want to have.
Yes, smiles matter, don't they?
Oh, it matters amazingly.
Yeah,
Yes.
it certainly
Yeah.
does. One other thing I want to ask you about the patient. So they call today to set up a consultation. The number you see on the screen there and the information for Sunshine Dental to get a mini dental implant consultation. How far in advance should they do that? When can they expect to, they come in and say, Dr. Jaime, I need this done tomorrow. But what's a realistic expectation for them?
Absolutely. We see our patients the same day that they call us, And if the patients are ready to have the dental work, we can even do it that day. So there is no waiting period in our office. Anybody that calls us, we're there for them.
All right. That sounds amazing, because how often can someone change their life with one phone call and have it changed nearly immediately?
Absolutely. Yes.
All right, that's a great reason to make that phone call, and we'll talk more about the after effects, the good after effects of a mini dental implant with Sunshine Dental.
Thank you.
My name is Fran. I'm from Albuquerque, and I wanted to have a prettier smile. I came to see Dr. Jaime during COVID. We were both wearing masks, and then she gave me the consultation and took me aside and told me exactly what was going to happen. I've gone to so many dentists, and I didn't want them to do the work. You go and have a consultation, you don't have the rapport or the feeling of that friendliness and that trust. I trust Dr. Jaime. Before I had new teeth, I didn't smile as much, and I'm a pretty happy person. So for me to be so self-conscious, it's not like me. It's not natural for me to not smile. And now I just can't stop smiling. I love crunchy stuff and savory stuff. So the first thing I did after I smiled was I ate some popcorn. I quit smoking and I'm eating better. It's a health change. It's a life change. My family and friends definitely noticed, but I work in a retail world, so I get access to a lot of people. And when people say something that didn't know you before, it's amazing. It was just a great experience. All of the staff and Dr. Jaime made me feel really comfortable, like I'm a guest in her home. But when I talk to her, I feel like she's a sister or a friend. I recommend it every day. Now people are asking me for her card, and so I'm passing them out at the store and at work, and it's amazing. Thank you, Dr. Jaime, and thank you to your staff. It's been a great experience.
But Dr. Jaime, we talked about some people, the dentures. There's another option for mini dental implants that we haven't discussed yet, and that's for people who have no teeth.
Yes.
You're out there. We know they're out there. They have no teeth. You have an option for them.
Absolutely. The other option is to place multiple implants on patients that have no teeth. For instance, this is one example. And we place these fixable teeth that are made of zirconia, and these are permanent in their implants. So they don't take it off, and they can be able to chew like the natural teeth. And they look beautiful, like they're coming right from their gums. There is no plastic in any of the parts like the dentures have, and they can taste their food, they can eat. It's just the best of the best.
I was going to say, that sounds like a great option for some folks out there watching right now.
Yes.
A solution for those who just going right now without teeth, which you don't have to anymore. That's kind of what we're trying to tell you. That's why you got to call Sunshine Dental for that consultation with Dr. Jaime, so you don't have to live without teeth. You should be able to have teeth, enjoy the foods, conversation, visiting with friends, and smiling, as you mentioned before.
Yes. This is like having their third set of teeth permanent in their mouth.
Excellent. All right, who is your typical patient?
Well, my typical patient is like, we just went through all these models. It's people has no teeth. They have been missing all their teeth. They've been wearing dentures for a while. Or people that are going in the process of losing all their teeth and they need to have a restorations. And for those kind of patients, we do like a permanent restoration like this, or we can do a regular denture that they had to take it off and put it in, and you hold on and stabilize the dentures in place. Or the typical patient can be somebody that are just missing one tooth, or that they are missing multiple teeth. So those are the patients that I see, patients that for whatever reason they have lost their teeth, and the mini implants is the solution for them to be able to replace the natural dentation.
You know, how far are people traveling to Sunshine Dental?
They come in from all over New Mexico. You know, we see them from different cities, and like I told you, we see our patients right away. And when they call, we are there for them.
All right, so folks, if you think you live too far away, you don't. If you think that you can't be seen, you will be seen by Dr. Jaime herself for that consultation, and then for the procedure, which we talked about. You're essentially in and out
Yes.
for the procedure, and you get your lifestyle back right away. It seems when it happens, just a few days to get things going. You'll call them the next day to make sure everything's great.
Yes, I do. Yes, we call them and make sure that they're doing well. And most of them are like, Dr. Jaime, this has been amazing. It's the best decision I ever made.
Yeah, life changing, right? People, I'm sure, come back to you when they come back for their 6-month checkup. They probably share stories and how it's changed their life.
Absolutely. I had a patient that came in a wheelchair with a caregiver, and he came and he sat in my chair, and he had a long hair, long mustache, a big beard in there, and had a loose denture. And I say, why are you sitting in the wheelchair? And he said, well, it's because I haven't been able to eat, and I'm so weak that I cannot even walk. So I was able to help him in the moment. We'll place the implants on the top and in the bottom, and I gave him a restoration just like this. He came to see me 3 months later. He had a haircut done, he shaved, he looks like a completely new person. He was walking, he was driving by himself, and he said, Dr. Jaime, I used to be very depressed. I used to drink a lot, and my life changed completely. Now I actually cook for myself. I go and watch a cooking channel, and I just changed my bad habits to a good habits.
Wow. I mean, it doesn't get any more life-changing than that.
It was amazing. It was so exciting for me to see him. What a big transformation that
Wow.
mini implants did for him.
Yeah, there might be somebody out there watching that maybe is in that same category, and you can help change things around for them. Folks probably wondering, all right, does my insurance cover this? If not, how do I pay for it? What do you tell them about insurance, financing this? How does that work?
Well, most dental insurance, they don't cover implants or mini implants, but my treatment coordinator and my implant coordinator is very special. She we have different partners with different companies for finances, and she's able to create a special program for them and very affordable.
Yeah, so that to me says your team is going to work with the patients so they can make this happen to change their life.
Absolutely. They work with the patient through the whole process.
Final thing, doctor, and that example you gave was a great one about changing life. What is your message to somebody out there watching right now who still is apprehensive, still thinking, I don't know if this is for me, I don't know if I can afford it? What can you tell them about just making that phone call to set up the appointment with you?
You deserve a new chance. You deserve to do yourself a favor and just come for a free consultation. Let's talk about what are your options at this point. Because the more you wait and sitting there hoping that maybe one day I can change my life by getting a new teeth, your bone can recede, your bone shrink. And so you want to hold on onto the bone so that way we can give you that restoration that you need.
And this technology, it seems like it's helped you a lot help patients.
Oh, yes. It's so rewarding for me to see the transformations and the beautiful smiles that I can create for them, and the excitement of the patient of finally now I can have an opportunity to go and get a new job that I need, or be able to date again, or be able to go for dinners and eat whatever I want to eat.
I knew about hygiene and taking care of yourself, but never did take too much time on my teeth. My mother is a hygienist, so in the back of my mind was her voice, brush your teeth, brush your teeth. But I would only brush once a week, and I just noticed my teeth had gone really thin and really worn out. I was like, oh my God, I look awful. And the teeth behind them were already black and rotted pretty much. Dr. Jaime looked at my x-rays and was telling me that I have a pretty extensive bone loss, and my gums were pretty infected, receding and pretty infected. And like I said, my teeth are already cracked in half, 2 of them. The other ones were shot. And I said, this is something I need. And then being a retired registered nurse, I knew health-wise, you need healthy teeth. Overall, I felt very welcome here. It's a family-oriented, very friendly establishment. Dr. Jaime was working on me, and she held my hand and asked me how I was doing, checked on me many times throughout the day. I was just like in shock that they weren't my teeth. I just couldn't believe that they were just so, beautiful in there. And it's the treatment plan that Dr. Jaime gave me that I'm following that actually is helping me keep my teeth in the sockets so I can keep these teeth. I want to bite everything. I feel like a shark. It's like they just like close perfect. They feel like my old teeth. I've been enjoying my teeth a lot more. I've been getting a lot of compliments. I went to my physical therapist, and she noticed them right away too. She was like, wow, you look like a new man with those teeth. And later on at home when I was flossing, I was thinking they do take off at least 10 to 20 years off your age.
Yeah, I hope everybody watching right now, and I'm sure it has, I'm sure your passion for helping people has gone through to folks watching at home, because I can feel it right now. I can feel how passionate you are about helping people.
Oh, absolutely. I love to change the life of those patients, and I know they are in need, and a lot of times it's the fear that is holding them back. So you need to give us a chance and show you how beautiful we can kind of transform your life.
All right, so there you have it. Dr. Jaime and her team at Sunshine Dental are here to help you with mini dental implants to help change your life. And doesn't matter how far away you are in the state of New Mexico or even beyond, Sunshine Dental, you're there to help.
Absolutely. Thank you.
Thank you so much for being here and teaching us about mini dental implants and how it can help people out there. It's great getting to know you even more, and we appreciate you being here.
Thank you very much, Kevin.
All right, and thank you for joining us here on Trending Health.